And on the Newsmaker show this morning, in this segment, it's St. James anesthesiologist Dr. Ismall Mehr. Dr. Mehr, you were here a week ago.
Yes,
So
how
much has
changed? I mean, unbelievable.
I want to start out with some sound bites from the governor. This is from a speech that Governor Andrew Cuomo gave yesterday.
At a minimum,
And he's talking about hospitals here.
Gotcha.
at a minimum, hospitals must give us a plan to increase capacity by at least 50%. So we would be at about 75,000 minimum against the 110 need. We would still have to find additional beds. I understand that. And you see what we're doing with the federal government. There's an opportunity there. But every hospital goal of 100% increase in capacity.
I want to stop it there. Dr. Ismall Mehr, we already know that St. James has the old Canisteo Street residence available. Your thoughts on what the governor said there about 100%?
Yeah, so I think I would like to clarify the old location, 411 Canisteo Street, is actually not owned by St. James. I've had a lot of questions from community members come to me and on Facebook and some messages. So Trinity Health out of Philadelphia owns that building. We turned in the keys, so to speak, when we moved over. However, that site can be opened up under the governor's directive for an emergency situation, and it's quite possible that could occur. But it's important for the community to understand that St. James physicians and staff would not be manning that, because we would obviously have our own hospital to take care of. If we were in a crisis where we're filling up St. James, then the old site would fall under an emergency act from the governor and most likely staffed by the United States Public Health Service, maybe the military medical teams. We're not there yet. Hopefully we don't come to that. But it's definitely on the table that the old site could be used. It just so the public understands that would be run by the state and the government if it comes to that. In regards to, I think the governor is doing the right things right now in terms of trying to build up capacity and prepare. I always say, I've been asked this, I said, if you pull me aside next month and say, you know what, this is overkill, we overdid this, that means we did our job. If someone pulls me aside and says, you know what, we really over-prepared for this, it wasn't that bad. Kudos to everyone in Hornell and across healthcare in the United States and everyone for social distancing. That means, we achieved our job and we're better for it. But again, that's all speculation if we're there or not. At the hospital, in terms of capacity, we have plans in place to actually increase our capacity, increase our by reassigning the beds. We have 2 units. We have our medical surgical unit, and we also have our beautiful ambulatory surgical center, which is our pre and post center, which has a significant number of beds, and we also have a recovery room. So Brian O'Donovan, our CEO, he's been manning the fort, so to speak, with the daily task force meetings. I'm really happy to be a part of a system that's really proactive, and we have multiple different meetings from supply chain to clinical care of a COVID patient to beds and reassignment of staff and whatnot. So we've been preparing for this. And we're ready here at St. James to take on that task to serve our community if the need comes. And we would be able to increase some of our capacity based on redistributing some of the wards in the hospital to facilitate inpatients.
Governor Andrew Cuomo has also spoken on the this isn't an executive order yet, but he's asked recently retired nurses and doctors and other medical professionals to come out of retirement, if it's recent, so that they could get back into the medical profession to help out. Do you foresee anything like that happening around here?
It all depends, Brian. I think it all depends on the numbers. Last week you and I were meeting, and we were a few hundred cases, I think, in the country. Now we're, over 36,000, 35,000 over patients. So It all depends on what's going to happen to the healthcare system. I know New York City, the metropolitan areas are getting hammered. You have to also realize it's not just COVID-19 patients that are sick. You have your normal daily sick patients who need the ICU, who need critical care. Your heart attacks, your kidney failure, your complications of diabetes. The normal flu is still going on. A lot of people are being admitted just for the normal flu also. So locally, there's potential for it. I'm glad the governor is sort of recruiting the recent retirees to possibly rejoin the workforce if need be. I think it's all good planning and showing proactive, coordination here, so that we're not caught with our pants down if this thing really comes through hard.
Talking to Dr. Ismall Mehr, the St. James anesthesiologist, here on today's Newsmaker show segment. Continuing now with Governor Andrew Cuomo.
We also have an intensive care unit bed issue where we have to increase the number of intensive care units. That is limited by the number of ventilators. What makes an ICU bed in this case? It's that the ICU bed has a ventilator. And that's where we get back to needing the ventilators desperately, so we have those ICU beds.
All right, let's stop it there. Dr. Ismall Mehr, let's get your response.
Yeah, so absolutely. What we know from China and from Italy and other European countries at the moment, where the epicenter is that if you recall last week, I discussed how 80% are going to be mild disease, 20% of the people who are infected will go to moderate to severe disease, more so on the severe side, which requires ICU care, requires to be placed on a ventilator or what we all know as a breathing machine. So yeah, it's of dire urgency to increase the number of those ventilators to have on hand. Again, kudos, and we did our job. If we have an excess of ventilators and we don't use them all, that'll be great news, but we need to have them to be prepared. Here at St. James, we've already done some inventory last week. We're, our team at St. James that's working on this, we've taken in inventory of all the ventilators that we have. We have some of the equipment left over from the old hospital, and we had some new equipment come in. So we've inventoried that, put that all together. So we have, I believe 12 ventilators for a hospital that has 15 inpatient beds. But like I said, we've also put into a plan that we can actually increase the number of beds by using the reassigning the surgical unit where we have our pre and post recovery units over there that can significantly increase the number of beds we would have. So we have plans in place, and we'll work with what we have. And I think we've done a tremendous job at St. James preparing for it. So far, we've been lucky. No inpatients that have come in with COVID-19. I know there's some cases in the county, as expected. So I think one thing is, people, I'll see on social media, they're taken aback. It's here. Oh no, it's here. Expect it to be here. I think that's the message I would send. Expect everyone, when you're out in public, to possibly be a carrier. That's why that social distancing is so important, that assume one is a carrier or you yourself are a carrier and can transmit to others. And if we all put that in mind and work with that, hopefully we'll get further. And I'd like to applaud the community for the social distancing. I see it. I know there was a lot of oofs and ahs by many, and as expected, but I think as things became more apparent and people understood what it means about social distancing and why, and understood that we can't be selfish because we're actually protecting 20% of the population that's elderly and immunocompromised, I think it's settled in. And I know a lot of people are doing some great jobs for the businesses in town, in terms of doing takeouts from our local establishments and really increasing how we can help support the local establishments that are going to be hurting and possibly hurting for quite some time. I know there's a group putting together a Facebook page for Takeout Tuesdays and Takeout Thursdays, trying to make a little community movement out there to really help our local businesses, and not just the restaurants and whatnot, all the other businesses as well. So, Hornell's a tough community. We've always gotten through tough times, and I don't expect anything less from us.
Dr. Ismall Mehr, I wanted to stop you on the topic of social media. You touched on that a little bit ago. What are your thoughts on what you're seeing locally in social media in terms of discussions about COVID-19?
I've seen a tremendous change from a week ago. A week ago, you saw a lot of people sort of, I would say a lot, but you had people who were questioning this, wondering if this is real, wondering if this, maybe a conspiracy or it's not that bad. Yes, people are going to get sick. Yes, people are going to die, and comparing it to the flu. And that, hey, it happens. I feel bad for it, but life's got to go on. I've seen a complete sort of turnaround, and I think everyone really understands this. And I think, it starts from the top. I think, the White House and our president has changed his perception of it as well as it really hit our shores, so to speak. That's when it really becomes evident that, hey, it's not going to be as easy as we thought, and it's here, and it's here to stay, and we really need to start to mitigating. So I think the message is coming down from top down, and I think that's what was needed, and it's really helping.
Dr. Mehr, another follow-up question on there before we get back to the governor's audio sound bites. There's a lot of talk, not only on social media but elsewhere, about the origins of the COVID-19. Most people seem to agree on China. The question is, where did this come from? Not the location in China, but
right.
How did it come about?
Right. Yeah. So, I think first and foremost, in the big picture, it's irrelevant where it originated. Viruses, they occur, they happen. We never really got so picky and nitty gritty on where did, if you remember when we were much younger, in the early 80s, where HIV originated, what country or who or how. So I don't get too fixated on trying to figure out where it originated or does it really matter in the big scheme. However, it is, from all the sort of literature and understandings out there, it is believed that, that Wuhan province in China, it's where the first cases were seen. So by default, right, it doesn't really take a rocket scientist, and I'm not one by any means, to sort of, to put two and two together, that first cases of this virus, it's a novel virus, which means it's a brand new virus, never seen in humans before, originated there. Coronaviruses is a family of viruses, as I explained before. They are known to come from animals, basically mammals to human. That process is called zoonosis, how it spreads from an animal to a human. So, and that's what coronaviruses do. SARS and MERS were other types of coronaviruses. COVID-19 is a third type of coronavirus, believed to have originated from an animal and spread to humans. First cases were seen in Wuhan, China. And then the way we realized medically that there was also human-to-human transmission was then cases started occurring in other parts of China, and the only thing linking it back was that the people who never had traveled to Wuhan had an interaction with someone from Wuhan. So that's how we've been able to do it. The global spread, the world is a small place now, as you know, in terms of connectivity, not just through social media, but just in terms of transport. So it was going to get out and spread. By no means is this. Should we be blaming China or Chinese people of Chinese origin? No, not at all. And I think I've seen a little bit of that here and there, not in our town, but online, maybe initially. That's like saying, then let's go back to HIV. Where did that originate? I think the first cases were sort of diagnosed here in the USA, but no one blamed us for putting that virus together. This is biology. This is nature. It's going to occur. It happens.
Talking to Dr. Ismall Mehr. We're going to take a quick break. When we come back, we'll continue playing the sound bites from Governor Cuomo's speech from yesterday, and we'll get Dr. Mehr's reaction to it.
Despite what's going on in the world, Cunningham Starring & Associates is here to help you do your taxes. As of March 23rd, we can't meet you face-to-face, but we are doing phone conference meetings. Whether you go to our website and upload your documents or use our drop-off or fax service, we can do your taxes. Or maybe you want to do an extension and we can help with that too. In the Hornell area, find us on the web at hornelltax.com. That's hornelltax.com, with drop-off times of Monday, Wednesday, Friday from 8 to 10 a.m. or 2 to 4 p.m.
The day we've been waiting for is finally here. A healthy new day for our hometown. The new St. James Hospital is now open. And we're so excited to enter this new era, where you and your family will receive medicine of the highest order, from emergency care to general surgery, all in a brand new, beautiful building, right here in our hometown. The new St. James Hospital, now open, part of UR Medicine.
We're back with Dr. Ismall Mehr in this segment of the Newsmaker show, and let's continue the sound bites here from Governor Andrew Cuomo.
We're putting out a Department of Health emergency order to hospitals that says we're not just asking you to do this. It wouldn't just be a nice thing. I'm not just asking you as governor as a civic obligation. This is a law that the hospitals must come up with a plan to increase capacity, a minimum of 50, goal of 100%. We're also canceling all elective, non-critical surgery for hospitals as of Wednesday.
And that's this coming Wednesday.
Correct. So, again, I can only applaud what we're doing here at St. James. And yeah, I'm biased, but I'm proud. And as you know, I'm really proud of our healthcare here in town. We instituted this last week on Monday. We went to no elective surgeries. We put that into effect and started pooling resources and assets together to know how we can be best prepared and positioned to take care of this. So right now through the end of April at St. James, we will not be doing any elective or semi-elective surgical procedures. Your routine hernias or a routine orthopedic hand procedure, sort of a regular urology checkup, or whatnot in terms of surgical procedures. However, we will be continuing to take care of all our emergencies as we always have, with the exceptional care that we provide from all our surgical services at the hospital. So yes, don't fear that if you have an appendicitis or you have an obstruction from a kidney stone or something serious like that wow, I can't get taken care of. If it's a surgical emergency, yes, absolutely. We have our call schedule will be doing that. Actually, just this past Saturday, I had an emergency come through and we took care of it. And that also, goes with many of our patients and population. People have time-sensitive things that need to be done in the area, and not just St. James, but across the University of Rochester healthcare system. Cancer patients have certain treatments that need to be done in a timely fashion, because they're time-sensitive. You have to have this port put in so you can get your chemotherapy. Not necessarily life or death emergency, but it's urgent. So all those things will continue, but elective procedures will be halted. If you ask us why or wondering why, it's to not overburden the healthcare systems across the state and also here in our community. Also, there's a national shortage of PPEs, personal protective equipment.
The gloves,
the masks, the shields, N95 masks, which are very highly filtering masks used in healthcare, and a lot of these things we use on our routine elective procedures. We have to use masks and gloves and shields and things like that. There's going to be there's a national shortage right now of this, so we also have to conserve stock. I mean, Hornell is adequately stocked at the moment. I mean, we've put together our stockpile. It's inventoried every day. There's the team behind the scenes is accounting for everything that is being used, and we know exactly what we have. But we want to also conserve it, right? Because if and when it does run out, and we're not certain if we'd get more right away. You can see New York City hospitals, and if you're following social media and the news, doctors are out there begging for protective devices. I shared a little something on Facebook last night where you wouldn't have a soldier going to war without a gun, or you wouldn't have a fireman go into a blazing fire without his protective equipment. So kudos to all the nurses, doctors, respiratory therapists, staff in hospitals right now that are going. Some are going in blindly because we just don't have enough stuff. And I feel for them and their families because they're also putting them at danger. So there's some true heroes out there right now who are putting themselves in harm's place just so they can take care of you. So once again, another reason for social distancing, because there's others out there who don't have the protective gear and the health care, but are going in every day to take care of those who are sick. So we need to do our part as well and socially distance ourselves so that they stay healthy and can do their jobs.
Down to the last several minutes with Dr. Ismall Mehr. If you can tell us, what's it like inside the new hospital now? What's it like, for example, in the emergency room and the inpatient bed section? What's it like with the COVID-19 added to the situation?
Yeah, so you have a grand opening. You start open up Tuesday morning. You're expecting a flurry of people coming through, patients, visitors, whatnot. All that sort of changed overnight. There's University of Rochester healthcare, medical system wide. There's restrictions on the number of visitors that can be coming in. You're going to get checked when you walk through the door and screened, and rightly so. So, all of that is what we expected a grand opening to be like is not. And that's okay, because we first and foremost, it's the safety of our employees and the safety of our patients and our community, and that's what we've instituted at St. James. So it's not the flurry that you would see or what you recall in the old hospital of people around. It's staff is there, but not visitors and things like that have been taken away from. Restrictions have been put in place for that, but that's all to protect and take care of everyone. In terms of functionality, amazing. The layout of the hospital. I'm not sure if you were able to take a tour, but those of you who've had, where the ER, how it's working, it's business as usual. People are still going to get sick. It's not just all about COVID-19. We still have sick people who need to be hospitalized and taken care of, and our nursing staff and teams across the board are doing a tremendous job. And also there's some pressure, and there's some on everyone also to, at the same time, be prepared for a potential crisis here in our community. So we're managing everything very well, and kudos to all the nursing leadership in the hospital that's really putting this together, because it's things like this start with our nursing staff first and foremost. They're the ones on the front lines, and then obviously us doctors and the respiratory therapist and the techs and everyone else comes into play and is part of the team as well. And we're ready. One thing I would like to share, Brian,
Sure.
when I was talking about shortage, I did want to share with the community that there is some national criteria for testing. Yes, there's been some increase in the testing ability here in the United States.
Glad you brought that up. Go over that.
Yeah, and last week I was talking about the criteria, and the criteria remains the same. So everyone is not a candidate to be tested. Yes, you may be feeling some malaise, some muscle aches, have a slight fever. And in a perfect world, you probably would have you get swabbed and tested. But we have a national shortage. And let's just be honest with it. That's, it's unfortunate, but that is what it is. And there's no reason to nitpick away why or who or this or that. We have a shortage. So testing has to be conserved. So right now the criteria is, number one, if someone has traveled to China or Italy in the last 14 days. And that, as we're getting further and further away, is probably will change to something else. Will replace that criteria, I would imagine. Number two is if you've come in contact with someone who is confirmed positive by a test, then you would fit criteria to be tested. And number three is someone who has a fever and has significant respiratory symptoms. So number three is where most of our community would fall. If you have a fever, a cough, a cold, and have some significant difficulty breathing, you get short of breath very easily. Normally you could go up a flight of stairs and no problem, and you've been having this fever the last few days, and now you go up that flight of stairs and you're short of breath and wheezing and not feeling good, you would fit the criteria to get tested. So let's not overburden our healthcare system here in town to just come in and to ask to be tested for COVID-19 because you're concerned, that you've had a cough but no other symptoms. and other things. It's just we don't nationally have enough tests right now to do that. I think the supply chain is still ramping up, and I think hopefully we'll get there. But just be aware of that. We're not trying to deny people for being tested. We need to conserve and get those tests to the people who are most in need first and foremost right now.
Before we go, I did want to ask you, and obviously for HIPAA reasons, I wouldn't want names, but would not want names, absolutely not. But have you seen any of the COVID-19 patients yourself?
No, right now at the hospital, I personally have not. And I do understand at the moment we don't have any inpatients with COVID-19. The cases that have been in the county are all under self-quarantine. I think that's public information.
Right.
On the Steuben County website.
It is.
So, but again, that's great. But remember, one person can transmit to up to 3 people. 3 people transmits to 9, 9 transmit to 27, 27 to 54 to 108. Do the math. So typically the first 5 to 7 days can be mild symptoms, and then the people who do get severe symptoms usually have been occurring in week 2. So I hope and pray these people do well, and they're in that 80%. But there is potential that they could turn the corner, or others who are infected could turn the corner. So that's why we've been meeting since day 1 last week of Monday here at St. James and preparing, reassigning assets, and planning on how we can increase our bed numbers and also isolate COVID-19 patients. And that's why we prepare, and we've been doing that behind the scenes.
Dr. Ismall Mehr, as always, it's great having you on.
Thank you.